Okay, ladies and gentlemen, my name is Danny Mensah. I am your lecturer for today, um, Unit 2, um, on your Level 3 Health and Social Care Diploma. And you would have to appreciate that it is important that as a healthcare, whether you begin to be a senior support worker or a normal support worker, you will need to understand the principles, values, and regulations that surrounds the healthcare sector. And this would enable you to comply with regulations within your company or within your employer setup and also beyond the setup so that you could do things in a way that does not breach policies and regulations. Okay. Can you guys hear me?
Yes.
Yes.
Good, good. I'll need relationship. Let's build some relationship. So if there's anything along the line, you can always um, show by your hand within the chat, or you could interject and say, please, can you recap? And I'll do that for you. Or you can leave a message on the message box and I can address them. Okay. Right. At this stage, I don't mind if you want to turn your videos off, you can. Okay. You can. And I will turn mine off as well. Now, I would want us to go briefly on what you expect on this particular um, Unit 3 program. So I want you to look at, first of all, the assignment brief. This is what we call the assignment brief. Okay, let's go through quickly, then I can start the real lecture. So the assignment brief, we expect that you would, that's it. So that's your task Unit 1, okay? And what we expect that the learner should be able to know what we call the policies, legislation, and guidance that should relate to a chosen country, aging, their home country, or a country in which they would like to work. Learners need to list government policies relating to health and social care and other policies that affect health and social care, such as economic policies, immigration, etc., and explain how policies affect provision, e.g., sufficiency of funding, commission of services, and infrastructure. Now, because your course component involves a pass and a merit, it depends on how you answer your assignment or how you present your assignment. That will determine whether you have to be a pass student or a merit student. And therefore, the course outline gives room for learners to achieve those qualifications. And so the pass is stated in here, but in terms of merit, which is a bit more higher than pass, it goes further as it says that learners should comment on how well the existing policy meets the needs of the population, AE infrastructure, sufficient, and more funding. So this is just an overview of what we expect having completed your assignment and how to present your lectures in that from that route here. So he said the assignment submitted by learners must achieve the learning outcome and meet the standards specified by the assessment criteria for the unit. To achieve a merit or distinction grade, learners must demonstrate that they have achieved all the criteria for these grades. Okay, where work for pass standard for marginal, assessors can take into account any extension work completed by the learners. The suggested evidence listed below is how learners can demonstrate that they have met the required standards. So as a lecturer, it's my duty to make sure that you understand these things and then make sure that I put you in the right path in submitting of your assignments and all that. Okay, all right. So this is just, so Unit 1, we'll do Unit 2 later on and we'll do Unit 3. And I'll go through similar thing whilst we're going through this unit. Okay, so just bear with me. I would have to now proceed to, now, as a form of introduction, Jesse, can you tell me your background? What do you do? And do you have any experience in healthcare at all, please?
No, I don't have much experience. I've done some voluntary work.
Have you?
With some special needs children, but that's it.
Okay, that's fine. Lusola, what's your background, please?
I'm a support worker.
You are a support worker. Okay.
Yes.
Well, what kind of back is it within a supported living setup or within a care home?
Care home.
A care home. Okay. That's fine. That's fine. So I'm going to start the roll my chest and then we take it from there. All right. There we go. Good to go.
There is also 2 other people on the Zoom now.
Oh, have they joined now? Okay. Can they introduce themselves and turn their video on so I can see them, please? The 2 who have joined, as a way of introduction, could you please introduce yourself, please? I hope they can hear me.
Hello.
Hello. Oh, there's so much feedback where you are.
Hello.
Yes, hello. Can hear you, please?
Yeah, my name is Oluwakemi Otuyibo.
Okay.
I'm a care assistant. I work in a care home.
Amazing. Amazing. Good. What about the other person, please?
Pardon?
The other person who have joined. You have 5 people.
Okay, right.
We have Olukemi, you've just spoken. Victor Martins. Can we hear you introduce yourself, please? And can we have your video on? Victor Martins, can you unmute yourself? Can you hear me?
Okay.
Olukemi, please, you have to mute yourself. There's so much background where you are. Victor Martins, can you hear me, please?
He said I'm at work.
Yes.
But
I'm
you
at
can,
work.
yes, but that's not good.
I can't
So
speak.
how can you contribute? How could you pay attention to the lectures? Martins.
Hello, sir. Come again, please.
I'm saying,
Come
how could you pay attention to lectures whilst you're at work?
Of course, I've separated myself. I'm the one alone here, but I can't speak. It will be rude of me. So I ran into the toilet just to listen to the lectures.
Okay, so can you introduce yourself? What do you do?
I'm a support worker.
Support worker. Is it a care home or supported living?
It's a supported living.
Okay, that's fine. That's fine.
Thank you.
So we are set to go. At least I have a feel of the background. So we have only, I think the rest of you are all carers. Jesse is getting some experience now and they're not carer. So that's fine. So we could all be on the same level and we could understand each other more. So let me crack on then. So the rules in today's lectures is that if you have any question to ask, please humbly you can draw my attention and I can recap, or you could raise your finger on the Zoom and I'll leave a message on the message box. I'll pick it up and then I can explain further if need be. Okay. Right. So I hope you can all see the screen and can you? I hope
Yeah.
you can see the screen, can you?
Yes.
Good. So on the screen is our lecture for today. And like I did mention earlier to Jesse and Olushola, our lecture for today is surrounded around the principles, values, and regulation in the health and social care sector. Why is it very important that carers or persons who seek to be carers should understand the principles, values, and regulations in the healthcare? It is very important. The reasons are you need to comply with policies as a carer within the care sector. And therefore, if you don't get yourself abreast with these principles and values surrounding or guiding with the healthcare sector, then you find yourself wondering because there are so many issues about bridges and against government policies that if you don't comply with those principles, you may have yourself even imprisoned or be affect your DBS or affect your fit for practice. Hence why you need to understand the principles and the values and the regulations surrounding you as a carer and what you need to do and what you don't need to do. It also helps you to comply with how you carry about your normal duties at work. Okay. So the first we're going to look at understanding the current policy on health and social care. Now, before I even move further, what the carers amongst you, what policies does come to your mind when you talk about some regulation within healthcare? Lusola, what policies that comes to mind in your experience when it comes to healthcare? Which few ones can you remember?
Okay, Care Act 2004.
Good. Good. That is fine. Look at me. Do you have any that comes to mind? Look at me. Can you hear me? Okay. Mr. Martins, do you have any that comes to mind? Okay. Obviously, Jesse, I'm sure you've read a bit about this. Do you have any? Do you remember of any?
The
Yeah.
Health and Safety Act.
Amazing. The Health and Safety Act. Amazing. Well done. So it tells you, look at a few things, the Care Act and the Health and Safety Act. Very important act that carers or even non-carers seeking to be carers will need to get themselves abreast with these policies, because there's huge demand on health and safety when it comes to care. Very, very important. The health and safety, one for yourself and one to protect the client that you might be taking care of. So it is important that we take note of health and safety. So let me go further and explain. Okay. So learner should identify current government policies related to health and social care in your chosen country. Explain the impact of policy on your health and social care sector and assess them. So now we would have to look into the policy framework that sets out principles of good practice in the management and conduct of health and social care in the UK. These principles protect and promote the interests of patients, first of all, service users, and the public, which includes you, in the public healthcare by describing ethical conduct, proportionate and assurance-based management of health and social care. Very important. So the Health and Safety and the Care Act and the management of medicine, all those acts, they are not there just to protect the patient, but also to protect you. In that, once you have done the right thing and you've conducted yourself in the manner that you have to do, when incidents happen, you are always protected. Okay, so we'll have to look into one of the key government agency that seeks to regulate policies and those government is what we call Department of Health and Social Care, DiHSC. It's a UK government department responsible for government policy on health and adult social care matters in England. Take notes. Health and adult is different from health and social care. Okay, so we have health and adult. Okay, health and adult care is different from the other. So the health and adult care is different from what the hospital does. So you realize that health and adult care will normally deal with the council. For those of you who work in supported living, you realize that it's the council that normally deals with all this adult care, give funding for clients and all that. And then you may have the other ones, which may be the hospital. Yeah. So do we have carers who work in care homes or work with supported living facilities? You may have carers or support workers who work in hospitals. Okay. It says that it oversees the English National Health Service, the NHS. The department is led by the Secretary of State for Health and Social Care with 3 ministers of state and 3 parliamentary under secretaries of state. Okay, now let's crack on and see. It says the department develops policies and guidelines to improve the quality of care and to meet patient expectations. It carries out some of its work through arm's length bodies, including executive and non-department public bodies such as the NHS England and the NHS Digital. How many of you know the NHS England?
I know NHS England.
Amazing. Okay. So we have NHS England and we have NHS Scotland. Okay. Then we have the NHS Ireland as well. An executive agents such as the Public Health England, the UK Health and Security Agency, and the Medicines and Healthcare Products Regulatory Agency. So these are all regulatory agencies that the Department of Health deals with and regulates. Okay. So let's crack on. Now let's go to the legislation itself. Well done, Elusula. You mentioned the Health and Social Care Act 2022. What does it do? It's one of the legal frameworks that deals with health inequalities. Okay. It included specific duties for health bodies, including the Department of Health, Public Health England, clinical commission groups. The clinical commission groups are the ones that work with the NHS. Okay. Clinical commission groups are clinical agencies that seeks to regulate how clinical activities are dealt with the hospitals and also sometimes the care homes. Okay. You know, those of you who have had a chance to work with the NHS or the hospitals, there's always what we call clinical. Unlike the care homes, that is a bit different, but with the hospitals, you need to be more clinical oriented to be able to work in the hospitals. Some of them are taking thermometers, and those are clinical duties. Able to do ECGs. Okay, how many of you know what we call ECG? Can you guys hear me? Do you know what we call when we say ECG? Do you understand? So ECG to be able to do thermometer or temperature and able to do blood samples or all those things are what we call clinical duties. Okay. Okay. And then the NHS England, which requires the bodies to have a due regard to reducing health inequalities between the people of England. The Act also brought in changes for local authorities on public health functions. So basically, it addresses all these health inequalities and seek to ensure that organizations or carers comply with these policies that the health and social care seek to address. Okay, so things that we are saying, the duties for health bodies, including Department of Health, Public Health England, clinical commissioning groups, and NHS England, which require the bodies to do due regard to reducing health inequalities. So when we say health inequalities, there are so many anomalies within the healthcare, and the Health and Social Care Act seeks to address those inequalities within the healthcare. The Act also brought in changes for local authorities on public health functions. Local authorities, then we are talking about the councils, okay? So once we've mentioned inequalities, then it's important we look at the Equality Act, because the inequalities in healthcare tend to look at a bit of the racism, a bit of unfair salary victimizations and all that. So it is important that we look into the Equality Act 2010. This act seeks to look into how you can treat people fairly, equality into the day-to-day activities of bodies subject to their duties. That in the duties of employers and in your duty as a carer, you need to comply with the Equality Act. Okay. The Equality Act established equality duties for all public sector bodies, which aim to integrate consideration of the advancement of equality into the day-to-day business of all bodies, subject to the duty. Very, very important. Okay. So you cannot, as an employer, there cannot be no victimization. You have to be very fair. You have to make sure there is equal distribution and equal playing field for all employees and all carers. You cannot discriminate. And this is what the Equality Act seeks to and teach. Okay. We also have to look into the Social Value Act. The Social Value Act 2012. This Value Act requires public sector commissioners, including local authorities and healthcare bodies, to consider economic, social, and environmental well-being in procurement of services or contracts. Okay, this is what Social Care Act does. 2012. Very important that we look into. Having said that, it also creates social value, has clear connections with efforts to reduce health inequalities through action on the social determinants of health. For example, by improving employment and housing. Okay, so social care act tend to look more into the local authorities, which is more to do with the council. They help in terms of housing, where if a patient is not well and an adult who is ill, you have to look into how they can rehouse them in terms of accommodation, make sure that the accommodation is fit for purpose. Probably is a disabled, you have to look into the kind of accommodation given to the disabled so that if he needs a wheelchair, improvement in the home, you have to do all those things. So the Social Care Act seeks to look into those things. So it's more local when it comes to the social care. Okay. Okay. Defining social care with reference to social determinants of health can help reduce local inequalities, improve the health and well-being of local people, and in longer term, reduce the demand on health services and other services. Okay. Very important. Do we have any question at this stage? Guys, do you have any questions? Can you guys hear me?
No, don't have any questions.
Okay. Olushola, any questions?
No.
Okay. Okay.
No.
Oh, that's fine. That's fine. So I'll round up and say the purpose of healthcare policies and procedures are to communicate to employees the desired outcomes of the organization. Okay. Very important. So for example, the economic policy of government covers the systems for certain levels of taxation, government budgets, money supply, interest rate, as well as labor market, national ownership, and many other areas of government intervention in the economy. This, I think, is not too relevant to a carer, though, but you need to know some of this. Okay, then let's look at the immigration policy. Is there any policy of state that deals with the transit of persons across its borders into the country, but Martins, you need to talk because if you're sending messages, okay. So I'm seeing your messages, but it's interjects me. Okay, yes. Okay, so I'll address your questions when I'm done. Okay, or you could ask whilst I'm lecturing, please. Okay. All right. Now, the immigration policy is any policy of state that deals with the transit of persons across its borders into the country, but especially those that intend to work and stay in the country. Immigration policies can range from allowing no migration at all to allowing most type of migration, such as free immigration. So we all know all that has been happening in the UK in terms of migrants and movement of migrants. Immigration policies seek to deal with all the transit of persons across its borders into the country. So making sure that the UK Border Force normally deals with that, ensuring that no illegal persons come into the country, or those who come in the country do not overstay, or they don't tend to become harm or threat to the citizenry. This is what they do. So almost any citizen or resident of any signatory nations may move and seek work anywhere within the UK. And it is a little that member states can do to stop it without leaving the EU or renegotiation. This was more to do with when we were part of the EU. Okay. So that because we are part of the EU, we had free movement to be going to the EU countries in and out. Now things are changing because the UK is out of the EU. So a bit of changes coming up now with transit and movement across Europe. Okay. Okay. Then we have to look at it so that he said there can be many impacts of that a policy can make on provision, such as provision of facilities, employment of staff, and the commissioning services, which I did explain to you earlier. Let's then look into the provision of facilities. Okay. You may have welfare facilities, but surrounded by those welfare facilities, within an hospital or a care home. You may have the Health and Safety at Work Act 1974. The workers must have access to, okay? Then you may also have the toilet and land basins, which you know if you work in a care home, all those things that you made available. You have somewhere to rest and eat your meals. Very, very important. You have a drinking water area. You have a place where you can store clothing and other things. So these are basic amenities that or facilities that need to be provided in an hospital or in a care home setup, either for the carer who works there or also available, accessible to the client as well. When I say clients, I'm talking about service user. Okay. Now, what are some of the healthy working environments? You know, I did explain. I say to have a healthy working environment, make sure there is a good ventilation, as we all know, supplying of fresh and clear air in those areas, a reasonable working temperature, which is very important to make it comfortable for people to work. Okay, lighting should be clear and visible so that people can see clear. Because you are dealing with sometimes service users who cannot see, or you need to move them around. And therefore, if there's no clear lighting system to comply with health and safety regulations, then you're going to find yourself wanting, and it's not the right. And that's the duty of the employer to do, and not the employee. But employee, you have the duty of care to ensure that if there's no lighting system working properly within where you work, you need to report it to your superiors so that it's addressed. Okay, there should be enough room and space suitable for working stations. Okay, you need to have a place where you could put in your information, whether it's a computer that you have to put in your daily activities, or a document where you can put in the daily activities notes in there. Very, very important. Those should be a clean working space. Of course, the place that you work should not be scattered with unnecessary things on the floor, or that poses health and safety to the staffs and the patients as well. So there should be a clear working environment. No sharp items left on the floor. Those are things that we have to take notice of, okay, or note of, okay. Now, what do we mean by a safe workplace? What do we mean by a safe workplace? Olushola, do you want to
All right. Safe workplace. It's putting into consideration the Health and Safety Act in place in order to protect the service user, to protect ourselves, and also to protect the colleagues at workplace.
amazing, amazing. Would anybody want to also, Madam Kemi, do you want to add something to it?
No.
Okay, okay. So, by Madam Femi, what, in your opinion, is a safe workplace? I mean, you were a carer. What do you, in your opinion, is a safe workplace for you? Can you hear me, please? Madam Kemi, can you hear me?
Yeah, I can hear you now. I'm using my
Yeah.
phone actually, so it's not that clear.
Yeah. So, in your opinion, what is a safe workplace for you? You were a carer. What is a safe workplace for you, please?
A safe what? Again?
Workplace, as on the screen.
A safe workplace.
You were a carer, aren't you?
Yeah.
So what is in your opinion, what is a safe workplace for you?
A safe workplace for me, first of all, is to protect myself first, and also the residents. First of all, I have to take safety of myself before anything as a carer. Yeah.
Okay. Okay. So I'm expecting to hear more about the setup of where you work. Okay. Yes, of course, is to protect yourself and the client. But then, would
Yeah.
you want to go to work to a place where the whole place is scattered? Would you want to work in a place like that?
Oh no.
Exactly. So I expect you to say that if you, I mean, as a carer, you go to work. Normally, carer, what they do when you clean up and all, don't you do that? You know,
Yeah,
go
the
to your
cleaning
office.
up of the rooms,
Exactly,
making sure the
exactly,
rooms are
exactly,
well.
exactly. Because you
Like,
want the place to be safe for work, isn't it?
yes, yes,
Exactly, exactly. So when you report to work and there are cups lie on the table, you normally tidy them up, don't you? Okay.
yes.
Yes. So this is what we call safe workplace because you want the place to be safe, clean, and tidy so that there's no obstructions. If there are items on the floor, you need to mop them. You need to
And clean them
clean
up.
them exactly so that there's a safe working environment. Other than that, it can bring about accidents and all that. And nobody wants to work in an environment which is not safe. Okay. Where you have to open windows, you do them so that there's ventilation. Okay. So you cannot work in a place when there's no light, isn't it? You can't
Yeah.
sit under darkness. These are what we call safe working environment. Okay. Doors cannot be broken and all that. When the door is not working for health and safety, if you work in a place where you need to close your door because maybe you have a service user that may come in, you have to make sure it is safe for you. Those are very important. Okay. All right. So let's look at the Employment Right Act 1996. Okay. That covers the right of employees in situations such as dismissal, unfair dismissal, paternity leave, maternity leave, and redundancy. Okay. So this is it. The UK law has certain legal frameworks that employers need to comply, and that of the employees as well. And when you become an employee to a company, when you are given an offer letter, in the offer letter, the employer will normally state what they expect you to do, your duties, isn't it? Okay, your duties in your offer letter, and they would also state in the letter normally procedures that you need to go through should you have any concern, what we call grievances procedure. How many of you have seen in your employment letters some of these informations?
Yes, I've seen it.
Amazing. And so employment rights gives you your right as an employee, but it should be done in tandem with what your employer have stated in your offer letter. Many employees don't read their offer letter that much until there's an issue. So you need to read your offer letter and ensure that what the employer stated, if should you have any issue, you comply with it. Okay. Now I always advise support workers who have lectures that as a support worker, if you seek to be a support, one of the first thing you need to do is to join a union. How many of you are part of a union? How many of you are part of unions? Guys, can you hear me?
I
Hello?
can hear you.
Kemi, Jesse, can you all hear me, please?
Yes.
So I'm asking,
Yeah.
how many of you are part of unions?
Planning to later.
Olushola, are you part of a union?
I'm
No.
planning that later.
No, you have to do it now, okay?
Okay.
Jesse, are you there?
Yes.
Jesse, you are looking to join the healthcare, but should you do that, I would want you to join a union, okay?
Okay.
Very, very important. Team, you need to be part of a union. Once you are employed, the first thing you need to do is not expensive. If you're a student and you join a union, you pay, I think, £5 or so. If you are a worker, you don't pay more than £10 a month, okay? You need to join a union because the unions will always protect you when you have issues, okay? You don't have to join a union because most times your employers, they really will not stand for you when there are issues. And therefore, you need to have a union. The unions would act as your legal and your lawyers in terms of any issues when it is raised against you. Now, there are so many rights as an employee, but there are also issues that when it comes to the employers, you can be dismissed. But they are unfair dismissals. Your employer cannot dismiss you. When issues are raised against you, for instance, when an allegation is made against you that you were sleeping on duty, your employer cannot just dismiss you based on face value. They would have to have witnesses and evidence. And when they have had those evidences, they will need to invite you into an informal meeting and discuss with you. They cannot just dismiss you. Can you hear me?
Yeah.
They can't just dismiss you.
Yeah.
Yes. So they will need to, there should be process that they need to follow. And if you don't follow these processes, you can take them on. And that's why you need a union. So you cannot, and that's the word, that's what we call the unfair dismissal. Have you seen that?
Yeah.
Unfair dismissal. So dismissal and unfair dismissal. Many employees or many support workers have been dismissed unfairly, but because they are not part of a union, they've not been able to fight the case. You know what I mean? Okay. So you need to be part of a union. There are so many happening, and you need to read your offer letter that was given to you. Okay. You need to. So before an employee would dismiss you, they will need to have clear evidence of the situation, whether if you were sleeping on duty, were there any witnesses. Sometimes people go further, even take photos of you sleeping, okay, and all that. And when they have met you, they have to write a formal letter to invite you for a meeting and give you the chance for you to respond. They can't just dismiss you based that somebody has reported that you are sleeping on duty or something has happened. It needs to be investigated, and when they find any probable evidence against you, that is when they would have to look into dismissal. Okay. And then when you are dismissed, or when there's any concern, you can do what we call grievances. You can also raise grievances against a member of staff if you are not happy with how you have been treated, and they have to look into it. Okay. You also have the right to resign at any time. Paternity leave, if maternity or paternity, if your employer is not being fair to you in terms of paternity leave or maternity leave, it's something that you can raise. Those are unfair because you have the right to go for everybody has the right to go for paternity leave or maternity leave. Okay. And those things are natural things or things that you deserve to have them as a support worker. All right. Okay. Let me move further to the National Minimum Wage Act. Obviously, I'm sure many of you are much aware with the minimum wage that is being paid in Manchester and in London. Okay. London has its own minimum wage. Manchester has a minimum wage. How much is the minimum wage for Manchester at the moment? Do you know?
11.4.
11.2. Good. London is slightly different, isn't it?
Yes.
Good. Good. Are you all in Manchester? Jesse, do you live in Manchester?
No, I live in Sheffield.
You live in Sheffield. Okay, but I mean, it's not far from Manchester, isn't it? So it's the same minimum wage, isn't it? Okay.
Yes,
So
it's
it
not
is
far.
important. It is important that we understand when you are even offered a job, look at the rate they're paying you. If it's far low, nobody should pay you £8 an hour. That is unfair, isn't it? Yeah. So if your rate says £8 an hour, that is illegal. That is illegal. So you need to know the minimum. £8, £9 an hour can be paid to young children, probably less than the age 20 years. Okay. But for adults, you have to be paid a minimum wage of that amount. Okay. Then let's look at the Employment Relations Act 1999. That seeks to establish a number of rights at work for trade union recognition and industrial actions. I mentioned the unions. Okay. So trade unions is one. One of the popular ones is the labor union. Have you heard of it? Have you heard of the labor union?
Yes, yes.
That's a popular one. Most people join. There's another one which is called the RCN. Have you heard of it?
No.
The RCN is the of nurses. Okay. Royals is of nurses, but as a support worker, you can still join them as well. Okay. Okay. RCN. You can write them down. Okay. Let me message you and read about them. RCN. Okay. RCN Union.
So what's the full meaning of RCN? RCN.
Royal College of Nursing.
Okay.
Okay. Guys, I hope you can all hear me. Royal College of Nursing. All right.
All right.
Good. Royal College of Nursing. You can read out. That's another union that you can join. Okay.
Okay.
or the labor union. There are quite a number of them out there. The labor union. All right. So these are union bodies that you can join. These are union bodies that you can join. All right. Then let's look into the part-time workers prevention of loss favorable treatment regulation, a UK labor law measure that requires that employers give people on part-time contracts comparable. So this I won't go further. It's talking about how many of you know about the 0 hours contract? Hello guys, I want interactive section, please. How many of you know about the 0 hours contracts?
That's like freelance working, isn't it?
Amazing, amazing. Guys, do you know about it as well?
Yes.
Good. So the part-time is more talking about a 0 hours contract. Okay. So most times it's forced normally under what we call agency work. Okay. Agency work where you are freelance, just like Jesse said, freelance, and you can choose when to work and when not to work. You are not obliged, you're not a permanent worker. You understand me? So you can choose to pick shift anytime and you can choose not to pick shift. So it's part-time. All right. Then we spoke at the Equality Act that I mentioned that it helps to prevent discrimination in the workplace. Okay. Any question at all? Do you have any question?
No question, apparently.
No,
Okay.
thank you.
That's fine.
No, no.
Okay, that's fine. Now, let's look at the commissioning of services. In accordance with the Health and Social Care Act 2022, commissioning is the process by which health and care services are planned, purchased, and monitored. Here we look at the commissioning processes in more detail, the organizations involved and how it is changing. Okay. So commission comprises a range of activities, including assessing the needs of patients, planning services, planning for services, procuring services, and then monitoring quality. Very, very important. These are the 4 key determinants of these commission groups. Very important. So now the concept of commissioning was introduced into the NHS in the early 90s when reforms separated the purchasing of services from delivery, creating an internal market. It was argued that making providers compete for resources would encourage greater efficiency, responsiveness, and innovation. These arrangements are evolved since the introduction, including through numerous changes to the structure and the remit of organization that commissions are. The current arrangements were introduced by Health and Social Care 2012. Okay, we've mentioned that severally in today's lecture. So for example, let's look at some of the assessments on this. Is the infrastructure sufficient? That's the questions we ask ourselves before the commission brings out the needs and what they need to do. Do we need more funding required? Is there any funding required probably for the needs of the person or the organization? Are inequalities being addressed and overcome? Very, very important. Okay. So let's look at infrastructure in healthcare. Infrastructure is a key pillar supporting the fundamental aim of promoting improved standards of care and well-being for all patients, together with a good experience of healthcare system. In parallel, the healthcare system and staff must support effective health promotion, prevention, and self-care of all population. So the infrastructure in healthcare basically is about looking into basic amenities that they need to infra. However, they need to assess the needs so they could know how many or what number of infrastructure that needs to be built or improved upon. Okay. All right. Infrastructure must integrate with the hospital, as a center for acute and inpatient care and should facilitate the 7 domains of quality: patient experience, effectiveness, efficiency, timeliness, safety, equity, and sustainability. Equity, fairness, timeliness, it must be within a reasonable time. Efficiency, it must be efficient and it should be effective. And the patient experience is very important. All that we do is what we call person-centered care. Okay. A carer should always know this. Person-centered care is all about the patients and not about you. Everything that we seek to do as a support worker is all about the patient's safety, the patient's well-being, the patient's safeguarding, the patient's recovery. That is all about care work. Okay. Infrastructure includes the built environment and supporting elements, equipment, access, information, systems, and processes. So this is all about infrastructure. IT systems are all part of infrastructure. The building inside is part of a safe working environment is all falls under infrastructure. Okay. Now, then let's talk about funding. Without funding, the government cannot take care of elderly people who are not well without funding, because a lot of them may be older, they are not working. So it is the funding that they've gotten from pension that people are paid, the NI deductions. It's all from the funding that they're able to take care of elderly people and those who are not well in their homes and in hospitals. Okay. The UK currently spends over 140 billion a year on public provisions of health and over 20 billion on social care. Do you see the difference between public health and social care? Have you seen them? Okay.
Yes.
Yeah. So I explained this earlier. So public provision of health and 20 billion on social care. Social care has to do more with people's homes. That's what you may say supported living. Are you there? Okay. Social care has to do with taking care of people, normally with the local authorities, where you call supported living. Sometimes some carers go to the homes of some clients to take care of them. You know about that. That's more to do social care. Where the public health has to do more of the hospitals. Okay. Funding is predominantly form of tax. It can be income tax, that's all, pay as you go. You know about that. Or national insurance and charities. I just mentioned that. Okay. Pay as you go. You understand that, don't you?
Yes.
Okay. Your
Pay
tax.
as you earn.
Yes, pay as you earn or pay as you go. Exactly. Yeah. Okay. POI. Okay. Those are monies that is taken from your salary every now and then. And in that element, they also do what we call NI deductions. Okay.
Yeah.
And then there's also pension deductions. If your employer is not deducting pensions or not paying for pensions, you can report the employer. If your employer is not doing any deductions, you can report the employer. Okay. Now, health inequalities. Those are being addressed in a number of ways. Training for staff, accessible appointments, mobile clinics for remote areas, health campaigns, care navigated to inform, advise, and direct on the right of service users. So these are ways to address health inequalities. Once there are regular trainings for staff, they then become abreast with some of the more treatments within the healthcare. Accessible appointment, making us appointment accessible to all. Clinics that helps, health campaigns that helps in addressing all these health inequalities. Okay, very important. And this is how we end today's lectures. Okay, this is just the so in today's lecture we have looked at a few things. Okay, we look at current government policies related to health and social care in your chosen country. Okay, so when you say your chosen country, you might be in the UK, but you can look into the policies in Nigeria or the policies in Zimbabwe or any other country. Okay, and also look into how our government policies been effective in your chosen country. The impact of those policies on the health and social care sector and on the provision of care within your chosen country. How the policy meets the current needs of the population. Does the policies that are introduced by the government, are they meeting the population demands, yes or no. Okay, are they meeting the demands? Okay, yes or no. All right. Those are things that we, and references, we use what we call the Harvard type of references. So these are references that you can get in your model that you can research more and read about. You know, the Department of Health and Social Care, you can get them from economic policy, the www.future.com. You can get all these things from your model. Workplace facilities, what you must provide, list of employment laws in the UK, what is the commission, how it's changing, infrastructure. All this information is on your model that you can gather as well. Now, like I
Okay.
did, it is expected that after every unit, within 2 weeks' time, you must submit your assignment. And therefore, if you look at the assignment framework, you understand the question that they want. Okay, and you need any support and advice, you can always. So we have about 3 units more to go. Unit 1, unit 2, unit 3, I think. And then after every unit, you need to start preparing for your assignment. And then in total, when you have completed the course, we do what we call assignment discussion. I go through with you the assignment discussion, what you need to do, advise you and guide you. And then you submit your assignment 2 weeks after you completed every unit. Okay.
Okay.
Do we have any further question? Guys, I need you to speak. Do we have any
No,
question?
thank you.
Mrs. Kemi, do you have any question? Is there no questions at all?
No,
I
I'm okay.
Alicia, you were saying something.
what I want to ask is on like you rightly said, some of the art and the guidelines for operating in health and social care. So we are expected to check on those references for a deeper knowledge, like you rightly said, right?
Yes, please. Yes,
Okay.
please. And in the further units, there's a few in the further units will explore more. And then if you can read about it on your reference and the model, it will help you as well.
All right.
Now, there was a question that Martin sent on the general message asking if the new current healthcare regulation is at no, the current act is at 2022, but the first one was at 2012. Okay,
Yes.
Martin, are you there? Okay, I've answered your question. Okay,
The law is just replacing the art is replacing the existing art.
thank you, thank you, thank you, thank you.
The 2012 replaced 2004 also.
Exactly, exactly. And
Yes.
2022 is a new legislation that it makes things easier for health organizations to deliver joint care. So I've answered his question. It's 2022. That's the current one. But the 12th replaced 2024, and then 2022 also revised the 12th. Okay.
Yes.
All right, Jesse. I hope you are getting understanding since you are not a carer.
Yeah,
Amazing. Do not
thank
hesitate. If you
you.
have any questions at all, you
No,
can
I
share.
don't have any. Thank you.
Okay. All right. So guys, I will bring the meeting to an end. Okay.
All right.
When is our next lecture?
3 p.m. tomorrow.
3 p.m. tomorrow. Okay.
Yes.
All right. So we'll meet tomorrow then. Okay.
All
All
right.
right.
Bye
All
bye,
right.
darling.
Take care.
Thank
Bye.
you. See you tomorrow.
Bye.
Bye bye.
Thank you.
Thank you.
Hello. Who's here, please? Hello, is there?